Hello viewers, hope you all are fine. So this is Dr. Sudha and I welcome you all to the educational video based on your AECC 1 Environment Study and Disaster Management compulsory paper for all plus 3 first semester BA B.Sc become students. As you all know that your Utkal University final semester examination is approaching. So the first semester exam will start from 21st, and on the first day you have your environment study and disaster management compulsory paper. Okay, so keeping this in views, I have already made one YouTube channel from before, and in which I have uploaded videos both in English medium and Odia medium for Odia medium students. Okay, so both in Odia and English language in different playlists. Previous year question is also here in this channel. You will get and according to your syllabus, you will get all the classes and its discussions. Okay, so just subscribe my channel and share among your friends so that all will be benefited. Okay, so for English medium students, almost I have covered all the units serially. First I have covered unit 1, unit 2, unit 3, and now I am in the 14th number of class of unit 4. So this is your everything you will get in the playlist. So for unit wise also separate playlist. So you all will get in my YouTube channel, and the name of my channel is Environ World for Students by Dr. Sudha. And you also can find my channel by typing my name in the YouTube, that is Sudhamai Behura. Okay. So let us without any further delay, let us discuss on today's class, and it will be on control measures for your different types of communicable diseases, under which we will discuss about surveillance, isolation, and contact tracing. So as I know that you all have heard all these words during the COVID pandemic period, isn't it? So it will not so difficult for your understanding. So dear students, आज some students of Odia medium, they have also requested me to make the video for them in Odia language. So after this class, means 14th numbers of class for English medium students, I will stop the discussion from here, and you will have only another 3 to 4 classes to complete your syllabus. But from tomorrow onwards, I will discuss some classes for ODM medium students also. Okay, so from unit 3, unit 1, 2 is also completed, and from unit 3, tomorrow I will start for ODM medium students. Okay, so be alert and subscribe my channel and share. Okay. So let us discuss what is surveillance. So surveillance is nothing but it is one system. Okay, a system of close, continuous observations. So what we do in the surveillance? We just observe. Okay, or we take observations. So it is a system of close, continuous observation of all aspects of the occurrence, distribution of a disease through systematic collection, tabulation, then analysis and dissemination, then timely of all relevant data pertaining to that disease or event. Okay, so first we have to describe all these things. Then in the second step we have to take action, that is public health policy. Okay, this is the surveillance. So now you see, suppose in public health approach, your surveillance information for action are your what is the problem. First we have to uh, analyze that what is the problem. Okay, then comes the risk factor, means identify, or we have to identify what is the cause behind that problem. Okay, then what we have to do in the surveillance? Evaluation. That means what works. So what steps should be taken to eradicate that problem. Okay, then last phase is implementation, means how do we do it. Okay, so this is the steps of surveillance. So surveillance, we can say, is the bridge between what we think is happening and what actually is happening. Okay, so it is a bridge between what we think is happening and what actually is happening. Okay, did you get my point or not? So surveillance, look here. So surveillance comes from two words. Sur means from above and velar means to watch. Okay, so surveillance is a systematic process of collection, transmission, analysis and feedback of public health data for decision making. Okay, so it is serves as an early warning system. Hmm. So surveillance is nothing but it acts as an early warning system for impending public health emergencies. Okay, and it documents the impact of an intervention or track progress towards specified goals. Then monitor and clarify the epidemiology of health problem to allow priorities to be set and to inform public health policy and strategies. Okay, so a dynamic vision of surveillance is to make decision, collect and transmit data, then analyze those data, then feedback information. So these are the entire surveillance system. So a good surveillance system adopts some techniques, that is simplicity, means minimum paperwork, so simple definitions. Then second is flexibility, third is acceptability, then sensitivity, then predictivity value, then representative, then timelines, then data quality, then cost effectiveness. Okay, so all these are the characteristics of a good surveillance system. Okay, so how surveillance helps us, or it uses of public health, or where it will be used. So surveillance helps in understanding natural history. Okay, then second is deciding levels of existence of disease. Okay, then third is your explaining changes in patterns with time, and fourth is your identifying changes in agent characteristics, and fifth one measuring efficacy of control measures and forecasting trends. Okay, then uses of public health surveillance: estimate magnitude of the problem, then determine geographic distribution of illness, then portray the natural history of a disease, then detect epidemics or define a problem, then generate hypothesis, stimulates research. Okay, then evaluate control measures, monitor changes in infectious agent, then detect changes in health practices and facilitate planning. Okay, so there are some standard protocol for surveillance as per WHO guideline. Okay, WHO, you know, that is World Health Organization, isn't it? So World Health Organization states that this is the case definition clear, appropriate, consistent throughout the surveillance system. Okay, is the reporting mechanism clear or not? Then is it efficient or not? Okay, is the analysis of data is appropriate or not? Then susceptible to proper presentation or not? Then used for decision making or not? So these are some guidelines or standard protocol to follow for surveillance as per WHO guideline. Okay, so there are different types of surveillance. So surveillance basically of two types, you can say. So first is active or passive. Okay, again it is community based surveillance or hospital based surveillance. So what is community based surveillance? Community based surveillance is an active process of community participation in detecting, reporting, responding to and monitoring health events in the community. Okay, community means the place where the people live, community. Okay, so the main reporters are community members who detect and report cases that might be otherwise not be reported to healthcare facilities. Okay, then third is to do this, community awareness campaign is essential to carry out, like educating them about the signs and symptoms of disease. Okay, then advantage. What are the advantages? To facilitate easy and early reporting, to keep vigilance at the community level, to get the community involved to so they understand their health problems, then to help people to be free from diseases, to improve the health of the people, then detecting individuals who do not seek medical care. Okay, then building healthcare network within community. These are the advantages of a community based surveillance. Okay, are you getting my point or not? Then look to the hospital based surveillance. So the main reporter in this surveillance system is physician or any proper system placed in hospital for regularly reporting and capturing information. Okay, so the hospital may assign any physician or proper system to take responsibility for such reporting. So here the role of the hospital comes, means the hospital or any personnel who is given the charge is responsible to give the or provide the data for the surveillance purpose. So this type of surveillance requires an accurate estimation of the demographic characteristics of the population under surveillance. Okay, so the hospital administration should be fully informed and understand the importance of surveillance at this condition. So there is another type of surveillance I told you, that passive surveillance. So passive surveillance, or that is also known as cold pursuit, that is ascertains cases by searching hospital discharge diagnosis. Then healthcare facilities or providers report cases as they represent in healthcare facilities. No specific efforts are made to make sure all cases are reported. Then surveillance is integrated to routine healthcare delivery and cases are identified as per case definition. Okay. So now come to the isolation. What do we mean by isolation? Surveillance, we know what is surveillance. Now isolation. So you all may have come across the word isolation during COVID-19, isn't it? So isolation means the separation of a person with infectious disease from contact with other human beings for the period of communicability. Okay, so we can simply define this isolation as, isolation is the separation of a patient from contact with other in order to control the spread of an infectious or communicable disease. Okay, then why this need of isolation? Isolation aimed controlling and preventing the spread of infection. Okay, means it aims to controlling and preventing the spread of infection. So isolation precautions are designed like room or wards to minimize the transmission of infection in the hospital by using updated and skilled technology. Then isolation helps to protect patients, family members visitors and healthcare workers from the spread of infection. Okay, and there are also different types of isolations. So some signs are used to identify types of isolation, and some hospital signs are disease specific and some are category specific. Okay, and the sign is removed when isolation is no longer required, and a checklist is also placed on the door, and this list indicate whether mask, gowns, gloves, etc. are required for persons entering the room or not. Okay, so patients are isolated according to the mode of transmission of the disease. So isolation, how a patient is isolated. So there are different processes, and it basically depends on the mode of transmission of disease. So according to the mode of transmission of disease, isolation are of different types. For example, one is your strict isolation, then your respiratory isolation, then protective isolation, then your strict isolation, then wound and skin isolation, then blood isolation, then discharge isolation. Okay, so what are those things? Strict isolation is used to prevent the transmission of all highly communicable diseases that are spread by both contact and airborne routine of transmission. For example, chickenpox, rabies. In this case, strict isolation is maintained. Okay, then what is respiratory isolation? So it is generally used to prevent transmission of organisms by means of droplets that are sneezed or breathed into the environment. That is known as respiratory isolation. For example, influenza and tuberculosis. Then third is protective isolation, and it is used to prevent contact between potentially pathogenic microorganisms and uninfected persons who have seriously impaired resistance. And examples are leukemia, who are on certain therapeutic regimens. Then fourth one is enteric isolation, that is used to control disease that can be transmitted through direct or indirect oral contact with infected feces or contaminated articles, and transmission of infection depends on ingestion of the pathogens. For example, hepatitis and dysentery. Okay. Then fifth one is your wound and skin isolation. So it is used to prevent the spread of microorganisms found in infected wounds, that is including burns and open sores and heavily contaminated articles. Okay. Then diseases that require precautions include herpes, then impetigo and ringworm. Then another is your blood isolation, that is used to prevent acquisition of infection by patients and personnel from contact with blood or items contaminated with blood. For example, as you know, in case of hepatitis B virus, HIV or AIDS virus, in this case, blood isolation is uh, adopted. Okay. Then some precautions are there. Direct and indirect contact transmission is the most frequent route of transmission of hospital acquired infection. Then direct contact transmission occurs when there is direct body to body transfer of microorganisms between an infected or colonized person and a susceptible host. Okay. Then third one is the indirect contact transmission occurs when an inanimate object such as equipment used on the infected person or unwashed hands serves as a vector of transmission between the susceptible host and the infected person. Okay, so these are the contact precautions. Then recommendations for contact precaution. There are some recommendations like place patients in a single room. Okay, then put on a gown and gloves before entering the patient's room. Then remove gown and glove just inside the door to the patient's room and discard within the room. Then wash hands thoroughly after glove and gown removal. Then dedicate equipment to the isolation patient, and if this is not possible, then equipment must be disinfected before being used on another patient. Okay, then the patient must remain in the isolation room at all times except for essential tests for procedures that cannot be performed in the room, and the patient must wear a cover gown and gloves when out of the room. Okay, then look here, this is a isolation ward in the hospital. Okay, so in hospital and other medical facilities, an isolation ward is a separate ward used to isolate patients suffering from infectious disease, and there are several wards for individual patients are usually placed together in an isolation unit. Then there are also some disadvantages like your increased patient dependency upon staff for support of needs, because the patients are in isolation, they cannot move for their own help. Okay, then additional costs such as construction, equipment, staff and time is also required. Then staff stress, especially in one-to-one nursing of isolated patients. Then insufficient use of hospital space, and single rooms are expensive, and under staff wards can lead to negative outcomes. These are some disadvantages of isolation. Then this is the isolation room in hospital. Okay, so there are also disease wise periods of isolation recommended, like for chickenpox isolation time is 6 days. Then for measles it is 3 days. Then German measles it is in the about more than 4 to 5 days. Okay, then your hepatitis A, or for cholera it is 3 days. Then for hepatitis A it is 3 weeks. Then for Nipah virus isolation is separate unit. Then for swine flu the isolation of infected individual, okay, highly efficiency mask. Then your for influenza it is 3 days. Then for polio 2 weeks. Then tuberculosis until 3 weeks of efficiency chemotherapy, or herpes zoster 6 days. Then mumps until swelling subsides. Then pertussis 4 weeks. Then meningitis. Then streptococcal, pharyngitis, meningococcal until the first 6 hours of effective antibiotic therapy are completed. Okay, so these were all the about your isolation. Then come to contact tracing. So contact tracing was one important aspect during your COVID-19 patient, means COVID-19 period, in order to break the break the chain, isn't it? So process of identifying, assessing and managing people called contacts who have been exposed to a disease to break the chain of onward transmission, means how the transmission of this disease will not pass from person to person rapidly. For that we have to identify the particular person who is having the virus, and that is known as contact tracing. For example, contact tracing for COVID-19 requires identifying people who may have been exposed to SARS-CoV-2 and following them daily for 14 days. Okay. So the goal is to stop transmission of the agent by reducing the number of people who are circulating with the agent. Okay. So how does contact tracing work? So defining contacts for COVID-19, anyone who had direct contact or was within 1 meter for at least 15 minutes with a person infected with the virus that causes COVID-19, even if the person with the confirmed infection did not have symptoms. Okay, that is, or that person will also be traced, and contact identification through case or interview. Then contact listing, or all persons considered to have contact with the infected person. Then informing contacts by phone or in person, and to be also informed about the goal of contact tracing, the process, and whom to contact with any concerns or your questions. Okay, then contact follow up. Your regular follow up should be conducted with all contacts to monitor for symptoms and test for signs of infection. Then data processes and analysis. The information on each contact person is gathered in a database and updated daily, monitoring to the person's health status. Okay, then look here how contact tracing is done. So identify contact. Initially there was 9 people, and out of which one was infected. Okay, so quarantining and daily monitoring of contacts for 14 days. Then so here 3 contact, then another was also susceptible. Then there are transport of 4 persons, those were infected out of 9. Okay, in this way your infection increases in the community. Okay, so we have to trace that. There are some digital technology. So what are these? That is digital proximity tracing, local tracing, data scraping or collation intelligence, then facial recognition. All these are in digital technology or used in digital technology. So in blue, that is location tracking, this one. Then yellow, this one is QR code. Then purple is facial recognition, this one. Okay, then your pink is your wristband tracking, this one. Okay, then red is your cell phone tower signal. Then your green is your CCTV. So these are the different contact tracing methods are adopting through technologies. Okay, then timing of contact tracing. This is the last part of our discussion for today's class. So comprehensive contact tracing should be implemented as soon as cases or clusters are identified, then focusing on vulnerable and household contacts and healthcare workers and high risk closed settings. Then when countries have passed a peak in transmission and the numbers of sick people are decreasing, then particularly when stringent public health and social measures are being adjusted, it is critical to maintain rapid identification of sick people and contact tracing. Okay, so these were all for today's discussion. Hope you all are very much or properly understand this chapter. Okay, so bye for today, and we will meet very soon again with one new video. And I have completed every bit by bit of your syllabus. So those who are watching my video newly, or who have visited my channel for the first time, so please subscribe my channel and go to the playlist. You will get all the discussions along with important questions, your previous year questions, then syllabus, everything you will find in this single channel. Okay, so thank you all for watching the video, and share and subscribe to give me or for supporting me. So thank you.